Welcome to Neethus Academy Live. I was just cautiously watching who all are going to be there. So welcome to Monday Live with me. Welcome to Neethus Academy. How are you all doing? Yes, did you all miss us for the past 2 days? Or you didn't? We definitely missed you all. So that's why we were so eager to come in front of all of you. Right. So as things are gonna get better on a daily basis, how is your practice going? That's the another thing that we definitely would want you to let us know. I hope all of you are doing excellent, isn't it? Uttam Kumar, good afternoon. Right. So as students are piling up, I hope you all would have seen what is today's caption. See, today's caption is all about, we were looking into the aspect of how to set from the start. Yeah, Sarah, Rennie, good afternoon. Good. I would definitely want all of you to have another icon next to your name. Why that icon? Because that shows how much of a support you're rendering towards us. How am I, Sarah? I'm doing excellent. Thank you very much for asking. How about you? Reha Wasapin, good afternoon. Shafina Shamir, good afternoon. I love to see at least one icon next to you. I could see a lot of one, a hand. What else could we ask for, isn't it? Jaspin Joseph, good afternoon. Savid Biju, good afternoon. Chinju Mohan, good afternoon. A very good afternoon. No matter wherever you are from, a very good morning and a very good afternoon and a very good evening to all my lovely students. Why good all these greetings? Because we have students who are attending from different time zones. Liba Tony, good afternoon. Zara, fine, thank you. Thank you for asking. It's my pleasure, isn't it? I would always love to communicate with all of you. The only way that I could interact is by your valid feeds. So please do not hesitate to type in. Delna, good afternoon. Lisha Jose, good afternoon. Sanita Jose, good afternoon. Liba Tony, good afternoon. Ashley Jose, good afternoon. Reshma Meni, good afternoon. Maria Chinabatini, good afternoon. Anku Thakur, Ankita, okay, fair enough. Good afternoon. Kavita Balaji, good afternoon. Nice to see a lot of prominent names. I could relate a lot of names. Last letter in C, good afternoon. Anybody who is attending the live for the very first time, if so, please do let me know that you're attending the live for the first time and also where you're from. Sumi John, good afternoon. Sharon Mary Varghese, good afternoon. Vinci Varghese, hi. Jeswin, and good afternoon. Joyce Inobin, good afternoon. Renu Joseph, good afternoon. Sonia Abraham, good afternoon. Preethu Varghese, good afternoon. So anybody who's attending the live for the very first time, please do let me know. Ramya Vasudevan, good afternoon. Sobi Vare, good morning. So as I've mentioned, okay, why? Manjusha, hi. I would love to, tell myself I know a lot of students, a lot of known people, across the globe. Tangasudha, good afternoon. And we have just pinned the official Neethus Academy social media platform. We have 2 Telegram pages. We have just pinned all our free access fit. Okay, we have the latest edition, which is our WhatsApp channel. That's also there. Delna, first time live from Muscat. Okay, thank you very much, Delna. So I have Delna who's attending from Muscat for the first time. Revati Krishnan, hi. Anit Jose, good afternoon. So I would definitely request all of you, if you have not subscribed to our channel, please do subscribe. If you have not yet liked to the page, same page that you're watching, please do like the page. If you have not yet followed, please do follow. By you would not miss any insight that we are coming in front with. So you will get all the instant notification. Aji Raicho, good afternoon. Merlin Elsa, good afternoon. Atira Sally, good afternoon. Now going back to what we are here for. Ben Jason, good afternoon. So today we have given how to get 20 out of 20. Okay, we have been, as we have promised, we'll be coming up with few things to make sure that you're all there. So first it was how to tackle it in 8 minutes. Then how to deal. Ben Jason, Neethu Tijo, good afternoon. Anumol Shaju, good afternoon. So every time we come up with a different insight, so that, see, it's not just about hearing in that, okay? You have to make sure that you follow it up. Okay, so we have given few important tips on the aspect, because we told you the importance of attending on a daily basis also. See, no matter whatever it is, you always have to remember repetition is the mother of learning. So how would you attend? You keep on attending, you attend on a daily basis, not just attending, and do incorporate, infuse it into your daily routine. Okay. Merrick Robert, good afternoon. Guidance regarding Part C. See, Merrick, I would definitely appreciate your valid feed, but however, you have to understand that is something that we have to give for our exclusive students. Even though we take you as a student, but there should be some advantage when our student joins us, isn't it? So we have taken it into a consideration, and we'll never know. Okay, maybe one day we'll just come up with a bang. Okay, so keep on watching. We'll never know when this thing can come. Neethu madam is always watching. Neethu madam is always looking into your comments. Maybe one day. Yeah. Jisha Sharon, good afternoon. Nimi George, good afternoon. I mean, happy to see you as well. Happy to see you. Mini Abraham, good afternoon. Now, what are the things? How to get 20 out of 20. Now, how many of you would want to get 20 out of 20 in part? Let me see. How many of you want this 20 out of 20? Who wants it? Nisha, good afternoon. How many of you say that you want 20 out of 20? Ashwita, Bangalore, good afternoon. 𝐼𝐴𝐧, good afternoon. Maria, the first one to respond, I want, is it? Mary gets always asked, we always consider our students as our highest priority. So we will definitely look into all those. And yeah, we will. I'm not a person to give you that right insight as of now. Rehami, Mini, I would, Joycey, Zara, yes sir, Anil, Tanga Sudami, Ashwita, I want, Atira, yes I want, Sony, I need 20, Binsi, Kannur, okay, I like it, Binsi AB from Kannur, so it's easy for me to remember. So Binsi from Kannur, Manavi Matthew, good afternoon, Siji, good afternoon, Sobi, I want, Jijo Thomas, good afternoon, Merrick 20 out of 20, okay, fair enough, Kavita Balaji, me, Sanita, I need, see, one, that urge, that what you have just told me, that itself is a catalyst, that itself is a triggering factor for you to achieve that. Now, why? Ankita, want, Anita Prabhu, good afternoon, Rajeshwari, Anil, good afternoon, Manjusha, I want, Anita, I want, Delna, I want, Delna Musket, okay, Neethu Tijo, I want, Liti Joes, good afternoon. So what are the things that you have to really look into? Nisha, yes, I want. Rajeshwari, I want. Fair enough, fair enough. That want is what that creates that craveness towards that 20. Okay. Sonia D'Souza, good afternoon. Jijo Thomas, I need. Neethu George, good afternoon. Kavita Vijayan, good afternoon. Marin Elsa, I need. Now, what are the things that you have to do? See, don't just avoid what I've told you, okay? See, doing in 8 minutes and all those things are everything on a stepping stone. It's just one after the other, it just follows. Okay? First and the foremost important thing, I missed few sessions, sir. No problem, Betsy, I do understand, but nice to see you in front of me. Neethu, I want. Sinini Clay, good afternoon. Betsy, I want 20. See, first and the foremost thing is about, see, I know Ria Teresa, yes, sir. Hi, sir, how am I? I'm doing excellent, Ria. Thank you very much for asking. How about you all? How about you? Generally, okay? Right. So now back to 20. See, first and the foremost important thing is about when you do a material, okay? We take it for granted certain things, okay? There are certain rules and regulations that you have to abide by, because precision and conciseness are the two most valued skill. That is what being assessed in your part A. Now, student doesn't understand why that is, okay? They just simply look into the aspect of taking it for granted. That shouldn't happen. Jisha Sharun, good. Yes, sir. So what is the first and the foremost important? Most of my students, okay, as far as I can see, 𝐿𝐿 Poppins. Good afternoon, a new name. So if there is anybody who's attending for the live the very first time, please do let me know as well. Now, why I was just talking about. See, we take it for, we're really happy to see your live classes, sir. I'm always there, Ria, just because of all of your profound love and affection towards me. I'm always there in front of you. Good enough. This is what, that triggers has to come in front of every day. That's because of all you lovely students in front of us. Now back to 20 out of 20. Just one and the foremost important thing that you have to always remember is, when you do a material, okay, we take it on the aspect of to be granted. Okay, now let's say you're writing an answer. Okay, let's take it the 1 to 7 questions. Match the following questions. Okay, there are still students who doesn't understand the importance of writing only what is given as per the instruction. See, the instruction clearly says 1 to 7 you are expected to write any of these letters, A, B, C, D, and you may use any of these letters more than once. But there are students who still write text A, text B, text C, text D. That is absolutely wrong. You are only expected to follow the instruction. That's why we have always advised all our students, do understand what the question is asking. The question is only saying, please do write any of these letters, not any text along with that. Okay, this is same applicable for the other session as well. Let's say you found an answer. Let's say the answer is hydrocortisone. Okay, certain students I have seen when I ask, because I ask my students to show the material on the screen, this is to see whether they are doing it right or not. So where I could see hydrocortisone bracket text B. Wrong. Even though hydrocortisone is an answer, because you have written text A or text B or text C along with that, that's an absolute wrongdoing, and that will not yield you any mark. Akila, good afternoon, with always with the heart. Yeah, Sunil, good afternoon. Anuan, good afternoon. Understood. These are the foremost important things. You are expected to understand the question. Please read, understand the question, and on top of that, you read the instruction and by heart it. Okay, it should come to you in no time. Don't worry about the time initially. It might take time. So initially when you're practicing, do read the instructions so that it gets into you. Because as I mentioned, repetition is the mother of learning. And the other foremost important thing is about eliminating your spelling mistakes. Okay, that spelling mistake is an absolute horrendous thing that you can always make a mistake in reading. Why? The spelling is there in front of you, and then also we are Ajish KM, sir, chirikkunnathu kaananamenkil Facebook live. Of course you have to. Because there is a reason. And I would, as I mentioned, I always tell my students the reason why I don't smile in my class. There is a reason which you will understand on the very last day. Athira, good afternoon. Hema, good afternoon. Right, now back to where we were talking about, okay, the importance of spelling mistake. See, when you assess, okay, this is where I told all my students, you not to assess, not when you're in the live, okay, when you're doing your practice material. See, it's not just about doing it in front of us, it's about how you practice. When you practice, what you do is the most important thing in order to yield that 20 out of 20. Okay, so when you're practicing, you let somebody else correct your answer. That's very, very, very important. Now, why that is important? We might feel, oh, okay, I know when I correct, I don't give the importance to spelling. See, our brain is equipped with that. But somebody else corrects it, okay? So you will have to really look into the aspect of making it a cautious effort. If let's say you don't have a chance to, ask someone else to correct. At least when you're correcting, you correct it with as if you're reading somebody else's paper, so that you give that cautious effort. If that spelling is wrong, please do mark it wrong. If the decimal point is not there, please do mark it wrong. If you haven't hyphenated a word, please do mark it wrong. If you haven't put any, let's say an apostrophe, anything, and see, sir, would you mind, can you please mention part B, I missed first class because of an on call duty. Part B, we'll be talking about it after I tell, because we haven't started part B yet. Okay, this is about getting 20 out of 20 in part A. Then another important thing that student doesn't give priority is how you write your answers. Okay, see, OE, let's say the question paper that comes in front of you. Okay, the question paper, what and how they have designed it, they'll give you ample amount of space for you to fill the answers in the given space. Okay, now what happens with students is we have that habit because we always write it above. Okay, so students, what they do, they fill the answers in that given space and the balance they write on top of the other words. Okay, that is also something which ruins your score, because it has been instructed saying if you want to get the full marks of what you have written, try to write it in that given space given, especially with fill in the blank words. Okay, see, they give you ample amount of space for you to write the answers, and that is why students doesn't realize the importance of taking printout and writing. See, you are expected to practice as what you do. It's for your benefit on the day of exam. So if you want to get 20 out of 20, do practice writing it in that given space. Okay, let's say you're not able to finish that word, or the group of words that is needed for you to write as an answer is not complete in that space. They have clearly given whatever the balance that is there, you write below the line, not above the other words or somewhere. You write below the line. Understood? These are places where you are losing. It's not that you don't find the answers. Understood how you're going to get 20 out of 20? I didn't tell you something magical, because I'm a person who always keep it very simple. So please do keep it very simple. Your marks are not gone because you don't have the talent. You do have surplus amount of talent that is inside you, but you don't use it on a proper way. Clear how to get 20 out of 20? I didn't ask you to do anything different. I asked you, from what you do it in a very different way. Understood the difference? Was it beneficial? If so, give me a quick thumbs up. Let me see. What are your comments on what I've just told you? Yes, sir, will follow. Thank you very much, sir. Sarah is the first one to always reply for the... Good enough. Any valuable feeds, because see, it's not just one way. Okay, I never take my class on a monotonous tone. So even though you're all there in front of me virtually, so I would definitely look into the aspect of how you reply to me. Maria, okay. Tanga Sudha, okay. Reha, yes. Binsi, yes. Okay, fair enough. Ashvita, okay. Fair enough. Savit, yes. Soni Beeman, good afternoon. After some time, Akila Sham, yes. Natira Sati, good, okay. Joyce, yes. Good. So this is where Hema Koshi, yes. Ajish, yes, it's beneficial. Thank you very much, Ajish. Neethu George, yes. Binsi, Kannur, yes. Ajish was the one to say, and supported by who? Hema, that you have to come to my life to see smile. Fair enough. Neethu, yes. Sibi, yes. Kavita, yes. Betsy, yes. Right. Now, because you have all been benefited, Uttam Kumar, exactly, we will follow your instruction. Thank you very much, Uttam. See, it's just a suggestion, okay? See, please do understand, it's not mandatory that you have to. Because our job as a trainer comes to make sure that we pump in a lot of things. See, we have an array of students who have different places, isn't it? Where you stand, depending on your exposure, depending on how well are you looking into. So, we can only suggest you. So, don't just swallow what I've just told. Try to do and see if it is beneficial. If so, please do. Okay, that's the only request that I have. Lastlet, yes. Neethu, yes. Liti, yes. Obi, yes. Margaret, good evening. Lakshmi, Sandeep, yes. Right, fair enough. Now let's go into what we are. So we will be talking about part B. As Nancy was saying, see, part B generally consists of smaller extract. Okay, where you get a small extract, which would be about 100 to 140 or 150 words. Then you will get a corresponding question along with 3 answer options. So please always remember, do not carry what you have done in part A to part B, because part A is about purely referring keyword, part B is not about keywords. Part B is about understanding the gist about the paragraph. You have to read, and as you understand, the sentences will be in a paraphrase form which conveys the meaning, not keyword. It's not about, okay, this word is changed to that. No, that doesn't come in part B. Okay, the elimination option is the best way to find the answers. Elimination doesn't mean that you have to search to eliminate. As you read the answer options, as you read the paragraph, eliminate the answer options and go. In order to do that, three fundamental things that you have to do in part B. One, read the question, underline the keywords in the question, understand the question. Very, very, very important. After that, you're going to relate it to your question. Okay. Now, generally we say 6 questions, 12 minutes. So roughly about 2 minutes per question, or 10 to 12 minutes. You can decide how quickly. So whatever that you're doing, there you have the material. Please do the material and then we will discuss. Right, time just eludes us, isn't it? It just goes quickly. It doesn't wait for anyone. Although, but I had 𝐺 Thomas who was saying the first answer. But again, as I mentioned, Sarah done, good enough. Now, it just goes, okay? See, please understand, even though the time is given for you to get that exam stress. Why? See, we always are very reluctant. We take our own time. Initially, no problem. But when somewhere you have to get yourself that pressure also, isn't it? Yes, Neethu, 𝐿𝐴𝐴𝐵𝐿, Tangasudha, Sobi, Reha, all done. Sanita, done. Good enough, good enough. Akila, done. 𝐿𝐴𝐴𝐵𝐿, done. This is what I love about all of you, is the active participation that you do. Because, see, in order for us to know that you are there actively participating, the only way that we could definitely look into is by your valid comments that you're posting. 𝐿𝐴𝐴𝐵𝐿, Jason, done. Kavita Balaji, done. Sharon, done. Ashley, done. Betsy, done. Kavita, done. Ashwita, done. Lakshmi, done. Right, would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important, okay? Because we always believe coming and fine-tuning whatever it is there, and how. Let's say if you have got it right, absolutely appreciated. If you have got it wrong, we are here to correct you, isn't it? So Maria done, Neethu done, Sibi done, Jilmi Sobin, good afternoon, done. Savit A. I had one more person who was saying, first person, 𝐵𝐵 AB, Kanur, done. 𝐿𝐴𝐧, A. 𝐵𝐵 A. Now, not just the answer, where you got that answer from? 𝐶𝐵, Merin, A. All are unanimous answers as of now. Jaswin, A. Whole paragraph. Okay, fair enough. Kavita, A from just. Okay, fair enough. 𝐿𝐴𝐧, A from para itself. 𝐿𝐴𝐧 was the first to say, isn't it? Neethu George, A from the whole text. Okay. Ashley Joes, A. Sarah Rennie, A. Whole para. Maria, A. Uttam Kumar, A from the first para. Okay, fair enough. Jilmi, A from the whole para. Okay, fair enough. Now the material will be popping up on the screen. Hema Koshi, A. Now you have to always remember, as I've mentioned, read the question, underline the keywords on the question, understand the question. That's mandatory. After that, you have two options. You can read the paragraph, then pick an answer. Or if you're like me, I'm a person who would want to know what I'm searching for in the paragraph. So what I do, I read my answer option, underline the keywords in the answer option, then I refer it from the paragraph. Anisha Sam, A. Ajish, A. Betsy, A. Kavita, A. So you all seem to be very adamant with A. Nobody have told me any other answers. Litty Joe's first para. So let's see what the things are. Okay, as soon as the material pops up on the screen, we will just look into that. So again, Sanita, A from whole para. Okay, fair enough. Litty first para. Okay, cool enough. Anybody yet who want to comment? Right, there you have the material. So what is the material talking about? First, read the question. Okay, so this is a notice is what they are saying. So this is a notice and it's giving information about. So always read these kind of questions. If it's not a complete question, the notice is giving information about differential management of infants using glucose. So differential management means various varieties of ways. So the notice is giving information about how to check infant blood glucose, how to check. Okay, now the notice is giving information about the ideal glucose concentration in infants. So ideal concentration, or you want clinical signs or whatever it is. Okay, now don't skip anything because it's a notice. You are expected to read the whole thing. So the management of documented hypoglycemia in breastfeeding infants. So this is definitely about infants. So infant and all is not something that you have to see. These are all something that you have to avoid underlining. See, infants is there. Blood glucose is also spoken about, isn't it? Hypoglycemia is all about glucose only. So these are all keywords that you should not, these are not supposed to be your keywords because these are very common. So infant is also not needed. Glucose is not needed. Now, differential management, how to check ideal concentration. These are the only thing that is needed. Now, going in. So they have two, A and B. So infant with no clinical signs. So these are the things that they are going to do, management ways of when an infant is presented with no clinical signs. So what are they doing? Continue breastfeeding approximately every 1 to 2 hours or feed 3 to 10 ml per kg of express breast milk or substitute nutrition. That is one. Then they are saying recheck blood glucose concentration before subsequent feeding until the valve is acceptable and stable. Avoid force feeding. If glucose remains high despite feeding, begin intravenous glucose therapy. Breastfeeding may continue during IV glucose therapy. Carefully document response treatment. So these are things which have to be done when they have no signs. Now they are saying infant with clinical signs. Now these are all the things that they have to do with clinical signs. See, initiate intravenous 10% glucose solution. Do not rely on oral intragastric feeding to correct extreme or symptomatic hypoglycemia. The glucose concentration in symptomatic infants should be maintained 45 mg per deciliter. Adjust intravenous rate by blood glucose concentration. Encourage frequent breastfeeding. Monitor glucose concentration before feeding, IV, and all those things. Now let's see what are they talking about. See, how to check an infant glucose level is a straight eliminator. Why? It is not mentioned in the text. Now the ideal glucose concentration, see they are talking about glucose concentration in clinical signs, but is that the only thing which is mentioned in the paragraph or in the text? No, they are clearly saying it is also talking about no clinical signs also. So this is also not the only thing which is mentioned. That is why this is eliminated. So differential management means a variety of management ways of infant using glucose. So congratulations to all of you, because all of you have got right answer. So I hope it was I wouldn't say easy, because why we have selected this. See, you had a lot of points to talk about, isn't it? Then what happens? Students' mentality changes. See, whenever we try to pick a material, whenever we try to give something, see, there are things that we can always say, very short one and very short thing, where it is not going to be of any benefit, because why? Most of us are very reluctant to read, isn't it? So our job as trainers or on the aspect of Neethu's family, what we do is, we would at least make sure that you read when you're sitting in front of us. Good enough. Maria is always happy dancing. Uttam Kumar is always balle dancing. Anisha happy. Kavita dancing. Ashwita happy. Binsi, thank you. Sonia Beeman happy. Kavita Balaji dancing. Good enough. See, you should always cherish your achievement. I always believe that, see, when we start enjoying what we are doing, we would definitely do it with a lot of intensity and happiness. That's the same with reading. Okay, we read as if it is a very tiresome and a most horrendous thing that you can do. See, I would definitely remind you, maybe tomorrow, let's say. Okay, Jijo Thomas, thank you. Pleasure, Rajesh, thank you. Sarah, happy. Fair enough. So as you all happy and all enjoying, my next question is, I know what is the name of the material, so I'm going to say radial head replacement. I want you to tell me how you felt about the material and how much time have you taken to complete the 20 questions. That is very important, because we have told you what are the things to do in 8 minutes. So let's see how much of you are progressing. How you felt about today's material and how many minutes did you take in order to complete? If so, you have, and let's say by you didn't attend and all, let's say you didn't look into or clock in the time. But from tomorrow, please do clock in the time. And I would always advise all the students to take the printout. That's why we are posting it a bit early, so that you have time to take a printout and do before entering the class. Ashwita is saying tricky. All right. The first review I got is tricky. How about others? Akila Sham is saying tricky material, but in 15 minutes. Fair enough. Ashwita, tricky, bit tricky. Okay, good enough, good enough. How about others? See, please do not worry about what others are saying. What you felt, please do let us know, because this is how we gauge about the material that we are pumping in, and also how are you taking in. Anisha tricky, Sarah tricky, 15 minutes. Savit tricky, 15 minutes. Atira, very tough to catch the answers, 15 minutes. Okay, fair enough. Let's see. How about others? Give me some valuable feedback from the aspect, because this is where we love to modify. See, Neethu madam will always look into this and then she makes up the material. So let's see. Because you all said few days back that it was quite easy and you wanted some challenging ones. So there you have. Jilmi, absolutely good enough. Done with 10 minutes, tough material. Absolutely good enough. I like it. Good, good, good. So that is all a possibility, isn't it? Come what may the material, you are able to tackle that time. That's what our purpose is. Our dream that we always believe in to come in front of you is to make sure that you all try to get that ample amount of time that is needed for you to check the answers. 𝐼𝐴𝐺, it's a great platform. Thank you very much, Ajish. Very kind work that is there, and it's all some morale boosters that we can always take it into, isn't it? Whatever that we are doing is beneficial for you. That's all what our aim is, and that's all what we want. So if you are practicing tough material now, exam time it will be easy. That's what our purpose is, Sarah. Good enough. Now let's go and see what are the things that you have to be very cautious with part A. I've been telling you a lot of things, and on top of that, a very quick thing is, how much time do we have? We have only 15 minutes, 20 questions. The purpose of part A is to make sure that are you able to locate specific information in quick time. I thought it was easy first, but struggled completing it. It's no worries. See, that is where that attitude should go. See, the attitude should come and say, I have my answers in front of me. There is nowhere that I should search for my answers. It is there right in front of you. When you panic, that's where you lose the answers. Purely keyword reference. Please do not try to comprehend. Please do not try to do anything. Just refer with the keywords and you will get the answer. I'll show you why. Now, skimming and scanning, that's a strategy. Very, very important strategy. And your scanning, I know that you're well versed with it, because you know scanning is for checking it in detail. Skimming means quick look. Now, what are the things that you have to look when you're doing skimming? I've told you what are the things. I'm just going to show you how to skim very quickly. See, they say 1 to 2 minutes, but I would stick to say 15 seconds per text. That's the maximum you take in order to skim. As when you're skimming, you should know what is the difference between each text, because 4 texts will be based on one common theme, but the 4 texts will be different to each other. Now see, radial head replacement surgery is a procedure of the fractured bone in the elbow and remove the replace with the artificial implants. The procedure is performed with the elbow insanity, which can be causing continuous pain and discomfort. Best treatment choice for patient injury that are internal fixtures. Surgery is a common requirement for 5 traumatic elbow surgeries and the radial head surgery, and they affect the women in the 30s. So radial and 1/3 of the fractures of the elbow below radial bone is an elbow, and where the fracture is compromised the stability elbow in long term, and the dysfunction, degenerative changes and stabilization of the joint can be achieved with the reduction of internal fixation alternative. Done. Maybe about 12 seconds today. Likewise, you have to skim through the other 4 texts. Don't worry about am I underlining a keyword or not. As you skim, underline, and don't try to underline the same words you have underlined over and over again. Okay, that's absolutely wasting our valuable time. Likewise, see, if you really look into the key important word is diagnosis. So all these text B will be about some diagnosis. Now text C, it's about some surgery with how during the procedure, isn't it? Now text D is about some study, because the numbers are 85. So anything with regards to study, go to D. Anything which is related to diagnosis, go to B. Anything which is related to during the procedure, go to C. And a general intro, A. Now I have a gauge about my 4 texts. Now I've told you the importance of 20 questions are divided into 3 types of questions. Okay, 1 to 7 is called match the following question, where if your skimming is proper, 1 to 7 is just a piece of cake, because you are not even asked to find the exact place and write the exact word. You simply ask which text is it. Understood? Right. Now let's read. What is the purpose of standard radiographic imaging? So where do you think it is talking about the purpose? And it's definitely there. When I was doing, it's there. These keywords, standard radiographic image, was only underlined in text B. Now, do you really need to look into the aspect of going into it? Is it talking about? No, that word only came there. So my answer is very straight. It is B. Understood? Now see, characteristics of artificial implants. So where are they talking about? Characteristics of it is artificial implants is said in C. So what are the characteristics means? Speciality, isn't it? So go and say it is in C. Good enough. I can see all of you are typing good right answers. Where is the incision made to access structures during surgery? So during surgery, do you really need to look into? Because during the surgery is only mentioned in C. I'm not going to do. This is how you manage time. Who are more easily exposed to radial fractures? So definitely I know women are more in the 30s and all. I underlined it. So they are clearly saying these fractures usually affect women. Done. A. Reasons to evaluate the magnitude and the extent of fracture. So where are they talking about all these reasons? And why to evaluate? So who evaluates? Doctor. So where are they evaluating and all? Definitely in B, isn't it? Diagnosis place only they are going to evaluate. So where are they saying to formulate an effective treatment plan? The doctor assesses the size and the severity. So the answer is B. Conditions to undergo radial head replacement procedure. So what are the factors that is affected or instances that someone needs to go through? So where are they talking about? It is there in A. So my answer is straight A. What is the count of patients associated to injuries post-surgical surgery? Count of patient means number of people. So number of people, I know that it is there only in that study. So do I need to count how many people? Not needed. D. Understood how you manage time? Then the next set of questions. These set of questions are called short answer question, where you have to by heart the instruction. The answer can be as simple as that of a word. It can be a short phrase. Short phrase means anything between 2 to 3 words. It can be number or numbers, okay, or both, word and a number. Shanita 7, absolutely good enough. Anisha 7, good, keep it up. Sarah 7, good. Love to see all those 7 out of 7 and all. Good enough. Kavita Balaji 7, good. So this is where you have to start telling, I am talented, isn't it? Good. So what might be, again, the type of question changes, but the strategy doesn't change. Ankita 7. Nisha 6, good enough. Betsy 7. What might be the basic age of women to be more susceptible? So do you really need any? Go straight to A. See, the average age is in there 30s. You can either write 30s as word, safest bet, or if you want to write number, no problem. But I would always tell you, do replicate what is given in the text. Betsy 7, Ginny 7, good. Now, what proportion of elbow fractures constitutes radial? So proportion, I know that it is somewhere I have read 1 out of 3. So is it there? The radial head fracture comprises of 1/3. So the answer is 1 out of 3. So which assessment method surpasses radiography in its inability to discern concurrent lesions, displacement, comminution, fractures? So where are all these keywords mentioned? It should be there during the procedure, isn't it? I mean the diagnosis plate. So a CT scan can provide better information and concomitant lesion, displacement, comminution of fractures, evidence, anything is there? The answer is a CT scan. CT scan is the answer. Now, what other therapeutic modality did patient receive aside from surgical procedures? So modality and all this is somewhere in D. So surgical treatment is there. What other modality? Conservative. CONSERVATIVE. Dharmosin, after a long time I'm seeing you. Good. Whenever I attend your class, almost 70% of my answers are right. Still I'm afraid. Do not worry. See, start trusting that your talent, that 30% is also not going to be a problem. That fear is that significant factor which is hindering you from searching for the answers. Don't worry. Start telling yourself, I am capable enough. Okay? Good enough. See, my job as a trainer is to give you solutions. You ask me, I'll give you solution. It is applicable because I always tell my student, you have any problem, you tell me, I'll give you solution. Okay? Likewise. Because we always treat Neethus Academy, take each one of you as our student. Okay? So, see, conservative management is wrong, Betsy. Why? Because it is there in the question, isn't it? But see, because it's therapeutic, it doesn't matter. I'm not saying it is because that treatment as such is not mentioned. So even conservative treatment is okay. Okay? Fair enough. Now, what is employed for securing the replacement component in an alternative manner? So employed, replacement, alternator. So where are they talking about all these alternatives? Is there in C, is it? I'm sure that it is there in C. Because an alternative which is given, it is there as, see, another way, alternative, where the fixing replacement part is to use uncemented prosthesis. So uncemented prosthesis. please ensure that it is a hyphenated word. UN-CEMENTED processes. Good enough. Now the next question. I'm sorry. What can be administered to evaluate joint stability adjacent tissues? So what should be done to stabilize something? So where are they talking? It should be there during or diagnosis. It should be there during diagnosis, isn't it? So what are you going to do? So pressure may be applied to the joint to test the joint stability and the surrounding tissue. So the answer is pressure. Pressure. Now, ultimate question for the second set of questions. What are utilized to seal the incision at the culmination of the procedure? So I love this word culmination and all. So incision at the end of the procedure. Okay, that's where you get that culmination and all. Utilized to seal. So at the last, isn't it? Though they should do something in order to conceal it. So where are they talking about? It should be there in C. So surgeon will check for proper fit and the motion, and then the incision is closed up using stitches or sutures. So there are two answers, STITCHES or SUTURES are the answers. Good enough. Now for the next set, these are called fill in the blanks question, where the instruction remains as such, but you have to always remember you're not supposed to repeat the words, even an article. Okay. Out of eligible patients, radial head fractures, dash of them decline to undergo treatment. So definitely go to D. Now where are they declining? So eligible patients, CT, refusal. How many refused? 29. So the answer is 29. Question 16. If the bone fragments in the radial head undamaged, dash would be unnecessary. Now these unnecessary and all those things, where are they talking? It should be there during the diagnosis. So something is not necessary. So what are they saying? Surgery can be avoided. Unnecessary pieces of bones in the radial head remains intact. So what is unnecessary? Surgery. SURGERY. Now question 17. The procedure that aims to alleviate. See, these are all important words. Whether you're doing B or A or anything, we always give you a lot of exposure to the words. See, alleviate and all is a very common terminology that you're going to get in C. So be aware of it. Alleviate, mitigating persistent discomfort and radial head replacement. So where are they talking about all these? This should be there in A, isn't it? This procedure is performed to reduce elbow instability, which can cause continuous pain and discomfort. So it's a two-word answer, ELBOWINSTABILITY. Conventional elbow radiography, including anterior posterior, radial head capitalium view, aid gauging the fracture severity. So where are they talking about all these? It should be there in B, isn't it? Diagnosis. So where are they talking about all these, and what is the only thing which is missing? So they are saying standard radiographic imaging, elbow, anterior posterior, one of our keyword, and lateral projection. That is the only word which is missing. So lateral projection, LATERALPROJECTIONS. Radial head replacement, preferred treatment, unresponsive. So who is unresponsive? Injuries or dash. So where are they talking about all these? It should be there in initial one, isn't it? So they are saying it is the best treatment for patients with injuries that are not responding to reduction or internal fixation. Two words answer again, INTERNALFIXATION. Question 20. To access the dash, a medical professional will navigate tendons, ligaments aside through the incision. So they're going to look through it, isn't it? To access which one? A very straight answer. Why? Because that is the whole talk about. So what are they saying? They are going to talk about after making the incision, the surgeon will move the tendon ligament on the way to expose your radial head. Two-word answer, RADIALHEAD. I have finished my 20. It's high time that if you have any doubts, please do clarify. If not, shoot me your total scores. Eagerly waiting because you all said tricky, tough, and all those. Let's see. If you have any doubts, you're always welcome to clarify. As I've mentioned, we are here to, clarify your doubts. Maria, 17, excellent, good enough, good enough. When you say a tricky question in 17, fair enough, isn't it? Betsy, 19, first time, but see, good enough, good enough. Kavita, 18, Savit, 17, good. Akila, 17, good enough, good enough, good enough. Uttam Kumar, 18, good enough, keep it up. Right. Although not much of people have commented on their score. See, doesn't matter. Okay, I have to tell you, come what may, whatever is your score, you should be able to tell that in a public platform, saying that I got this. It is not for others. It is for you alone. Ashwita, 17, good enough. Now, why that is important? Because that's another way to get over whatever that unwanted thing that we are holding on to. What if others think what I am not capable of? Others have nothing to do. If you start believing in your capabilities, it's not. See, this is not your place where you're going to end your life, isn't it? You go reach there and say, see, I know I told 10, but I am there. 1 to 7, all right. Such a good trick. Okay, fair enough. Good enough, good enough. I'm happy with all your valid feedback. So because you don't have any comments or anything, so it's high time that I say thank you very much for giving us another opportunity to come in front of you. Until and unless I meet you all tomorrow, adios from me. God bless you all. Take care. Bye.